Assalamu alaikum. Ultra Scan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right and the lower left wisdom teeth. As you can very clearly see, the lower right wisdom tooth is horizontally impacted. This is the transaxial view, which is basically the proximal view. You can see the crown portion here. As we are moving distally, you can see the two roots separate. This is the mesial root, this is the distal root, and this is where the inferior alveolar nerve is. As you move further distally, we can see that the inferior alveolar nerve is at its closest point 4.5 millimeters away from the apex of the inferior apex of the wisdom tooth. So the inferior alveolar nerve is in no way going to damage or cause problems during the extraction. Now, as far as the tooth itself is concerned, the tooth is placed center of the ridge. So you've got a thin lingual cortical plate, but an extremely thick buccal cortical plate. The tooth and its roots are completely embedded into the ramus. So that is something that has to be kept in mind. Now moving to the lower left side, this is the lower left side. You've got a angled tooth. You've got a slight mesioangular tooth with the tooth's crown tilted towards the lingual aspect, as you can very clearly see right here. But also here again, despite having short stunted roots, you've got slight curvature in the roots, which is visible right here. And you can see that the lingual cortical plate is also prone to fracture, and you can also see how the tooth is embedded right here. So this is the situation. This is the axial view. We'll show you the axial view as well. And here you can see that the tooth is positioned in a manner where the crown is lingual and the roots are buccal. So this is something that the doctor has to be mindful during the extraction process, as this is not a very conventional angle for a wisdom tooth to be in. Thank you very much.